Okay. So we can use hemodynamics to calculate velocities in chambers and blood vessels. If you remember when we did Doppler, um, we, we look at the velocity of moving structures. So we can apply the Doppler principle and combine it with our hemodynamics to get velocities. So we can get velocities of chambers and blood blood flow in blood vessels. Um, for those of you who are familiar with tissue Doppler, so tissue Doppler look at the velocity of the tissue. That's how fast the tissue is moving, and we that's we can either do that using Doppler principle or um, speckle tracking echo. So we'll go over that, but we can use hemodynamics to measure velocity, pressures, of course, gradient across valves or shunts. We can use it to calculate stroke volume and cardiac output. So you have to go back to your basic uh, physiology. Remember that stroke volume is the volume of blood that the heart pumps out per beat. And then cardiac output is the volume of blood that's pumped out per minute. So when you calculate or you have your stroke volume, if you multiply it by the heart rate, you get cardiac output. And valve areas is a crucial part of echoes. Um, we have a lot of patients with aortic stenosis and some with mitral stenosis, but today, when we evaluate someone with aortic stenosis, we don't need to take them to the cath lab to to do a valve area. We can do that in the echo lab. So we can fully assess aortic valve in the cath lab, looking at the valve area, the gradient, and stuff like that. Uh, Regurgitation, when we assess the severity of regurgitation, looking at regurgitant volume and regurgitant fraction, we use our hemodynamic principles as well, and then regurgitant orifice. So your regurgitant volume, regurgitant fraction, and regurgitant orifice area, these are parameters that we use to assess the severity of the regurgitation. There's all hemodynamic principles. So hemodynamic is basically involve more than half of your echo studies. Um, the first thing we're going to look at is our Bernoulli equation. So the Bernoulli equation look at a flow in a closed system or a closed circuit. So if you have a closed circuit, the principle states that the flow at one point is equal to the flow at another point in the system. So if you have a closed circuit, that is, it's not leaking. You don't have any leak anywhere in the circuitry. The flow at one point is equal to the flow at another point. So the flow at point one is equal to the flow at point two, as long as you have a closed circuit. What is going to be different is your pressures. So the pressures and velocities are going to be different at the different points in that closed circuit. Okay? When we talk about gradient, gradient is a pressure difference between 2 points. So if we have 2 points, point 1 and point 2, and we want to discuss the gradient between point 1 and point 2, It is the pressure difference between point 1 and point 2. Okay? If you have, say you have a fluid flowing in a closed circuit, and it starts at point 1 and it travels to point 2. In order for you to get flow from point 1 to point 2, as long as it's not, inclined, even if it's inclined, you have to have a pressure difference. You have to have a gradient. That is the only way you're going to get flow from point 1 to point 2 or from point A to point B. Okay? So this is what we're talking about. So this is a closed circuit. So if you look at this as a pipe, okay, and you have any fluid that is flowing in this circuit, okay, the flow at this point is equal to the flow at that point. The flow is the same. The gradient is different. The pressures is going to be different. The velocities are going to be different, but the flow is the same. All right, we'll come back to that, but let's look at the Bernoulli equation, because understanding the Bernoulli equation is very important. So if we have a closed circuit and we have point 1 and point 2, you have flow from point 1 to point 2. The difference in pressure between point 1 and point 2 is what we call the gradient. Okay? If you have a difference in pressure, you're going to get flow. All right? If you have any closed system, if there's a difference in pressure, you will get flow. And the flow in this circuitry is from point 1 to point 2. It's moving in this direction. So therefore, you expect the pressure at point 1 to be greater than the pressure at point 2. Okay? So the gradient is the difference in pressure. So it is P1 minus P2. That is the gradient. Okay? Because you have flow from this point to this point. Okay? The fluid is flowing in this direction. So therefore, the pressure at point 1 have to be greater than the pressure at point 2 for you to get the flow. Okay? So what Bernoulli came up with was the gradient, which is the difference in pressure, is equal to what we call convective acceleration plus flow acceleration plus viscous friction. Okay? So the gradient, the pressure gradient, is determined by these three factors: the convective acceleration, flow acceleration, and viscous friction. The convective acceleration is half rho. Rho is the mass density, and you're going to multiply half rho velocity at 0.2 squared, so the velocity here squared, and you're going to subtract from that the velocity at 0.1 squared, so there's a velocity right there. Okay, so this component is the convective acceleration. So the pressure gradient, the difference in pressure, is equal to the convective acceleration plus the flow acceleration plus the viscous friction. So this is your convective acceleration. Okay, half of rho is the mass density, v2 the velocity at 0.2, v1 velocity at 0.1, and you're gonna integrate so it is velocity over time multiplied by distance. So this is the flow acceleration. Okay, and you know that velocity, change in velocity with respect to time, is acceleration. You know that. So you're just going to integrate the acceleration from point 1 to point 2. Okay, so this is your flow acceleration. and then the viscous friction is uh, is R times the velocity. R is your resistance. So this is the viscous friction. You don't have to memorize all the equation. You just have to know that the different components. Okay, you know that there is a convective acceleration, flow acceleration, and viscous friction. So again, the gradient or the pressure difference is dependent on the viscosity of the fluid. Okay, you know that if you have a fluid that is not viscous, it's gonna run freely, as opposed to a fluid which is very viscous, very thick. It's not gonna run very freely. Okay, and that is going to depend on resistance and the velocity. So this component is the viscous friction. This component is your flow acceleration. Okay, and then your convective acceleration. We deal with blood. So when we deal with blood, the viscous friction is similar to the viscous friction of the blood is similar to that of water. So we can call this 1, okay, and the flow acceleration uh, is negligible for blood, so you can probably call that 0. Okay, so what we're actually dealing with is just your convective acceleration. Okay, but this is the full Bernoulli equation. Okay, gradient, which is the pressure difference. The fluid is flowing from point 1 to point 2, so therefore the pressure at point 1 have to be greater than the pressure at point 2 for you to get flow, and the difference in pressure is what we call the gradient. Again, it's equal to the convective acceleration plus your flow acceleration plus the viscous friction. Okay, so again, P1 is the pressure at location 1, P2 pressure at location 2, rho is the mass density or just the density of blood, V1 velocity at location 1, and V2 is velocity at location 2. So when you plug that in the equation, okay, assuming that because we're dealing with blood in the clinical scenario, the flow acceleration and viscous friction, you can just ignore that, okay? So in clinical practice, you can ignore your flow acceleration and the viscous friction. And this is what is important. So the gradient, in essence, is equal to, of course, the gradient is the pressure difference between point 1 and point 2, is equal to half rho, which is the density. You're going to times that velocity at point 2 minus velocity at point 1, and you square the velocities. Okay. When you simplify this, okay, we assume if you're not if you have a area of stenosis, which is so if we assume that this narrowing right here, if we assume that this narrowing right here is not very long, okay, then we can ignore the velocity at point. You can ignore your velocity at point 1, okay. If it's not a long stenotic area, so the gradient, which is the pressure difference, is equal to half rho into V2 squared minus V1 squared. So if it's not a long stenotic area, you can ignore this. So the equation becomes, well, before we get to that, half of rho is for blood is equal to 4. Okay, because the mass density of blood is about 8, so it will be half of 8, which is equal to 4. Okay? So gradient is equal to 4 into your velocity difference squared. But remember what we say, it's a short segment, the stenardic area is short, you can ignore V1. So when you simplify that, you get that the gradient, and this is a symbol we use for gradient, is equal to 4V squared, because for a short orifice, short segment that's stenardic or narrowed, you can ignore this. So all you have to concentrate on is the velocity at the narrowing. Okay? So this is a very important formula. This formula you're going to use throughout your echo career, because this is the formula for gradient. Gradient is equal to 4V squared. So if you can get the velocity at any area, you can get the gradient between 2 points. Okay? In clinical practice, say for instance, we have tricuspid regurgitation. When we talk about tricuspid regurgitation, we talk about blood moving from the right ventricle across the tricuspid valve into the right atrium. That is tricuspid regurgitation. Blood is not just going to flow willy-nilly like that. You have to have a pressure difference. The pressure in the RV have to be greater than the pressure in the RA in order for you to get blood flowing from the RV to the RA. So there is a gradient, and that pressure gradient is going to generate a velocity. The blood is going to flow across the tricuspid valve with a certain amount of velocity. If you can get that velocity and you square that velocity and you multiply it by 4, then you get the gradient across the tricuspid valve. All right, so the gradient across any area is equal to 4V squared. So this is what we call the modified Bernoulli equation. Because remember, we're coming all the way from here. This is the full Bernoulli equation, which states that the pressure gradient, okay, so you have a narrowing right there. If it was not narrow, you wouldn't have a gradient. You wouldn't have flow unless you have a generator or it's on an incline or something. If this is completely horizontal and there is no narrowing, say it's completely straight, okay, you're not going to get the fluid is not going to move. Fluid is not going to move. Okay. However, if there is a gradient, if there is a difference in the pressure, okay, if there's a difference in the pressure, then you'll get movement from the high pressure zone to the low pressure area. Okay, so the pressure here have to be greater than the pressure there. The difference in pressure is what we call the gradient. And what Bernoulli did was to do a number of experiments to come up with this equation. Okay, convective acceleration, flow acceleration, viscous friction. In clinical scenario for blood, you can ignore your viscous friction, you can ignore your flow acceleration, and you're just left with your convective acceleration. Okay, if the area of narrowing is not very large, you can ignore V1. That's the velocity right there. You can ignore it because the velocity at this point is going to be much greater than here. You can ignore that. And then for blood, mass density is approximately 8. So half of 8 is 4. So that is why we end up with this equation. Pressure gradient is equal to 4V squared. Again, it's a very important formula. You're going to use it throughout your echo career. All right. Again, let's look at let's look at tricuspid regurgitation in depth. So again, when you have tricuspid regurgitation, okay, when you have tricuspid regurgitation, blood is flowing across the tricuspid valve. It's moving from the right ventricle to the right atrium across the tricuspid valve. So the pressure in the right ventricle have to be greater than the pressure in the right atrium. Okay? If so the pressure gradient is equal to this right here. Okay? The RV. So if you remember, tricuspid regurgitation occurs in systole, right? Tricuspid regurgitation occurs in systole. So the right ventricular systolic pressure minus the right atrial pressure in systole. So this is the gradient, okay? Because remember now, when you have tricuspid regurgitation, the blood is flowing from the right ventricle into the right atrium in systole. So therefore you have a gradient. And the gradient is the RV systolic pressure minus the RA pressure. That is the gradient. If you can get that TR velocity, if somehow you can get that TR velocity and you square it and multiply it by 4, then it's equal to the gradient, which is this. Okay? But remember, you can get your TR velocity by just putting the Doppler. So if you do Doppler across the tricuspid valve, you can get your TR velocity. Okay? You can get your TR velocity, and your TR velocity, which is the gradient across the tricuspid valve, is equal to the RV systolic pressure minus the RA pressure. Clinically, it's important for us to know what the RV systolic pressure is. It is of tremendous importance to us in a clinical setting to know what the RV systolic pressure is. Because remember, the RV systolic pressure is equal to the pulmonary artery systolic pressure unless you have an obstruction at the right ventricular flow tract. The RV systolic pressure is equal to the pulmonary artery systolic pressure unless you have an obstruction at the right ventricular flow tract. So if you can calculate the RV systolic pressure, you're gonna know what is the pulmonary artery systolic pressure. And you can start diagnosing pulmonary hypertension. Okay? So just by using or modified Bernoulli equation, we can get the pulmonary artery systolic pressure. Okay? And it is of tremendous importance clinically to know what the pulmonary artery systolic pressure is. So that is why 99% of the patients coming to the echo lab, we need to give a RV systolic pressure. And in essence, what we're doing is giving a PA systolic pressure, pulmonary artery systolic pressure. So again, the gradient, if we have tricuspid regurgitation, the gradient is the RV systolic pressure minus the RA pressure. Okay? So if you rearrange the equation by moving your RA pressure on this side, then you'll get your RV systolic pressure. So the RV systolic pressure is equal to the gradient plus the right atrial pressure. Again, remember what we said, the gradient Once you have the TR velocity and you square the TR velocity, multiply by 4, you get the gradient. So all you need to do is to add the right atrial pressure to that, and you get the RV systolic pressure. And in essence, as long as there's no obstruction at the right ventricular flow tract, you'll get the pulmonary artery systolic pressure. Okay? We have a separate lecture to go over how you get the right atrial pressure. But for now, once you have the right atrial pressure to the gradient, and this is the gradient, 4V squared, you'll get the RV systolic pressure. And in essence, the pulmonary artery systolic pressure. Okay, so the right ventricular systolic pressure and the pulmonary artery systolic pressure are synonymous unless you have some obstruction at the right ventricular flow tract. Okay? Again, the modified Bernoulli equation, okay? Pressure gradient is equal to 4V squared, where V is the TR velocity, okay? Tricuspid regurgitant velocity. And your pulmonary artery systolic pressure is equal to the RV systolic pressure unless you have obstruction. So those of you who not sure what we mean by unless you have right ventricular flow tract obstruction, you need to read up more about it, or you need to talk to me one-on-one because it's important. If you have something like pulmonary stenosis, you can't use this equation, doesn't this relationship doesn't work. So for someone who has tetralogy of Fallot, and if there's right ventricular outflow tract obstruction, it's not going to work. Okay, if the patient have, say, Noonan syndrome, and they have pulmonary artery stenosis, it's not going to work. So this equation is only true if there's no obstruction at the right ventricular flow tract. All right, so we have been doing a lot of echoes, and this is an example of tricuspid regurgitation. This is a short axis at the level of the aorta. So this is your right ventricle right there, tricuspid valve is right there, and this is the right atrium. Okay, your transducer is right, your probe or transducer is right there. So there is this blue color, which is here. Okay, remember, flow towards the transducer is going to be in shades of red. Flow away from the transducer is going to be in shades of blue. And then you put your Doppler. Okay, so you see Doppler across the tricuspid valve, and you get these envelopes. Okay, again, your ECG is right there. Okay, remember, systole is from the onset of the QRS to the end of the T wave. So you get these systolic flow, periodic systolic flow. Okay, and you can get a velocity. Remember, on the horizontal axis, you have time. On the vertical axis, you have velocity. Okay, so you can see the velocity right there. The machine gives us a velocity of 2.89 meters per second. Okay, so you need to use C Doppler because the velocity is usually greater than 1.52. Okay, so when you have a velocity which is greater than 1.5 or 2 meters per second, you cannot use pulse wave Doppler, so you use continuous wave Doppler. Okay, so you get the gradient, you square, so you get the velocity, sorry, you square the velocity, you multiply it by 4, and you get the gradient. The computer did it for you, but you have to know what the computer is doing. Okay, it squared the velocity, which is 2.89, and it multiplies by 4. So this is the gradient across the tricuspid valve. The gradient across the tricuspid valve, because blood is flowing from the right ventricle across the tricuspid valve into the right atrium. So the pressure difference between the RV and the RA, that's what we call the gradient. That's this number. Okay? The only reason why blood flow from the RV to the RA is because there's a pressure difference. Okay? And we call that tricuspid regurgitation. We can get the velocity. If we square the velocity and multiply by 4, we get the gradient. Okay? So all you do, remember so the gradient is the RV systolic pressure minus the RA pressure, and that's equal to the gradient, which is this. So to get your RV systolic pressure, you just move your right atrial pressure to the other side of the equation. So you add the right atrial pressure to this, and you'll get the RV systolic pressure or the pulmonary artery systolic pressure. Again, we have a separate lecture to show you how to determine the RA pressure. All right. So all you have to do is just think about pressure difference, because once you have a pressure difference, then you have a gradient, and then if you have a velocity, you can calculate that gradient, 4v squared, using the modified Bernoulli equation. So now let us look at PI, pulmonic insufficiency. All right. So again, just try and have a clear understanding. Don't try and it's simple. Okay, it is simple. So don't try and think in terms of something complex. When you have pulmonic insufficiency, you have blood flowing from the pulmonary trunk across the pulmonic valve into the right ventricular flow tract. That is the definition of pulmonic insufficiency, pulmonary regurgitation. The normal flow of blood across the pulmonic valve is from the right ventricular outflow tract across the pulmonic valve into the pulmonary trunk. That's a normal flow. If for whatever reason blood is flowing in the opposite direction, then we call that pulmonic regurgitation or pulmonic insufficiency. That only going to occur in diastole. Okay? Pulmonic insufficiency or pulmonic regurgitation is only going to occur in diastole. Remember, in systole, that is why I went over anatomy and physiology and everything before we get to this point. In systole, blood is going to flow from the right ventricular outflow tract across the pulmonic valve into the pulmonary trunk. That is in systole. At the end of systole, the pulmonic valve is supposed to close. If the pulmonic valve is incompetent in diastole, if the pulmonic valve is incompetent, then blood is going to flow back from the pulmonary trunk across the pulmonic valve into the right ventricular flow tract. But that can only occur if there is a pressure gradient. Once you have pulmonic insufficiency, it is telling you that you have a pressure gradient. And the pressure gradient, it is from the pulmonary trunk back to the right ventricular flow tract. So the pressure in the pulmonary trunk have to be greater than the pressure in the right ventricular flow tract for the blood to flow backwards. All right? So you have to have a pressure gradient. All right? So what we're saying, if you have pulmonic insufficiency or pulmonary regurgitation, the pulmonary artery end diastolic pressure pulmonary artery end diastolic pressure have to be greater than the right ventricular end diastolic pressure for blood to move from the pulmonary trunk across the pulmonary valve into the right ventricular flow tract. And this pressure difference is what we call the gradient. So the gradient for you to get pulmonic insufficiency or pulmonary regurgitation, the gradient is the pulmonary artery end diastolic pressure. That is the pressure in the pulmonary trunk at the end of diastole. And this is the pressure in the right ventricular flow tract at the end of diastole. But because the blood is flowing in the opposite direction, this pressure has to be greater than this pressure. But the difference is the gradient. Okay? All right? So the gradient is equal to the pulmonary artery end diastolic pressure minus the RV end diastolic pressure. If you rearrange your equation, you'll see that the pulmonary artery end diastolic pressure is equal to the gradient plus the right ventricular end diastolic pressure. But if you think, but don't think too hard, let's say it's simple. The right ventricular end diastolic pressure is the same thing as the right atrial pressure. So if you want to calculate the pulmonary artery end diastolic pressure, all you have to do to the gradient is just add the right atrial pressure. So you can get not only the pulmonary artery systolic pressure, but you can also get the pulmonary artery end diastolic pressure. And these are tremendously important clinical parameters. Okay, you know, a few years ago we had to put invasive catheter into patients to get these information, but you can use echo Doppler and hemodynamic principles to get pulmonary artery systolic pressure and pulmonary artery diastolic pressure. Let me just show you. Let me show you. So when you have pulmonic insufficiency, you get an envelope looking like this. Okay. On top here is your two-dimensional echo. This is short axis at the level of the aorta. Your cursor is coursing across the pulmonary valve. Okay. So it's right here. As you know, this is the right right ventricular flow tract is right there, pulmonary valve is right there, pulmonary trunk is there. And all you have to do is press your Doppler button, okay? And you press your C Doppler, continuous wave Doppler, and you get a Doppler envelope looking like this. So you have an early velocity, early diastolic velocity, and you get your end diastolic velocity, okay? All right, so this is your early, and this is the end diastolic velocity. So this is the velocity that we're talking about, okay? So to get the gradient, so remember, pulmonic insufficiency occurs in diastole, okay? You can see it, it's your ECG is on top, okay? Diastole is from the end of the T wave to the QRS. So this is a diastolic phenomenon. You have a early velocity and you have a late, or you have your end diastolic velocity. So this is the velocity you're going to square. You're going to square it and you're going to multiply it by 4 and you'll get the gradient. Okay, so you'll get the gradient across the pulmonary valve, which essentially causes the pulmonic insufficiency. So to get the pulmonary artery end diastolic pressure, to the gradient, you just have the right atrial pressure. Again, we have a separate lecture to show you guys how to determine right atrial pressure. So just for right now, just take it that you're going to hand the right atrial pressure to your gradient in order to get your pulmonary artery end diastolic pressure. Okay, so when you get your PI envelope or your pulmonary regurgitation envelope, it is the end diastolic velocity you're going to use. Okay, you have an early velocity and you have a end diastolic velocity. It's the end diastolic velocity you want to use for that. Okay? These are the definition for the terms. All right. What about left atrial pressure? Anytime you can calculate pressures in the heart, that is tremendous, because in certain clinical scenarios, getting the pressures inside the heart is very important. Okay? Getting the pressures in the heart is tremendously important. So, anytime you can calculate any pressures whatsoever, it's important. So, if you want to calculate the left atrial pressure, and calculating left atrial pressure is very important, all right, you have to use mitral regurgitation. So, again, think of it in a very simplistic, or from first principles, then, not simplistic. Just when you have mitral regurgitation, what's happening is you have blood flowing from the left ventricle across the mitral valve into the left atrium. That is the definition for mitral regurgitation. Blood flowing from the left ventricle across the mitral valve into the left atrium. So if blood is going to flow in that direction, then the pressure in the left ventricle have to be greater than the pressure in the left atrium. That's the only way you're going to get blood flowing in that direction. Okay? So the gradient then, which is your left ventricular systolic pressure, mitral regurgitation is a systolic phenomenon. Mitral regurgitation can only occur in systole. So the gradient, which is the pressure in the LV minus the pressure in the left atrium, so your LV systolic pressure minus left atrial pressure, that's the gradient. Okay? So if you want to calculate the left atrial pressure, you just rearrange the equation, and the left atrial pressure is equal to the left ventricular systolic pressure minus the gradient. Okay? Now, the gradient, as we've been saying all along, gradient is equal to 4v squared. So you get the mitral regurgitation velocity, you square it, you multiply it by 4, and that's the gradient. And once you subtract the gradient from the LV systolic pressure, you get your left atrial pressure. Okay? But if you think a little bit about it, the LV systolic pressure is essentially the same as your systolic blood pressure. Okay? The left ventricular systolic pressure. So this is the pressure in the left ventricle in systole. It is the same thing as your systolic blood pressure, as long as you don't have any obstruction across the aortic valve. So as long as you don't have any obstruction across the aortic valve, your systolic blood pressure and your LV systolic pressure is going to be the same. So the patient shouldn't have aortic stenosis then for you to use that equivalency. So that is why it's very important when the patient comes to the echo lab, you need to get a blood pressure. Okay? So you need to get a blood pressure. You need to get vital signs when the patient comes to the echo lab, because in some scenarios, you're going to use the systolic blood pressure. Okay? All right. So again, the V is the mitral regurgitation velocity. This is your left ventricular systolic pressure. That is the pressure in the LV in systole is equal to the systolic blood pressure if there is no obstruction across the left ventricular flow tract. There's no aortic stenosis. There's no nothing like your SAM or your HCM with obstruction, hypertrophic cardiomyopathy with obstruction. Okay, so again, so if you're going to use that, say your TR velocity. So these patients have tricuspid regurgitation. Okay, this is a two-chamber view with your cursor is across the mitral valve, and you get these MR velocity envelope. Again, your ECG is on top. Okay, systole is from the onset of the QRS to the end of the T wave, onset of QRS T wave. So, okay, so mitral regurgitation. The velocity, that's what we're interested in. So this velocity, okay, is your MR velocity. So this is your MR velocity, which is 5.54 meters per second. You square it, you multiply by 4. So the gradient now is 122.9 millimeters mercury. So gradient is usually in millimeters mercury. Okay. So the difference between your LV systolic pressure and the left atrial pressure, which is the gradient, 4v squared. So this velocity squared multiplied by 4, and you get this number, 122.9. So to get your left, because we are interested in knowing what the left atrial pressure is. So once you rearrange your equation, you can see that the left atrial pressure is equal to the LV systolic pressure, which is your systolic blood pressure, minus the gradient. All right. So left atrial pressure. When patient go into heart failure, usually the left atrial pressure is elevated. When patient develop pulmonary edema, the left atrial pressure is usually elevated because for you to flood the lungs with fluid, okay, blood is moving in the opposite direction. So therefore, the pressure has to be very high to overcome the normal phenomenon, which is forward blood flow. So if blood is going to flow in the opposite direction, the left atrial pressure is usually elevated. So this is a very important number to calculate or to have, because it gives you clinical information. All right. So if you can calculate left atrial pressure, you are one step ahead of everything. So these hemodynamic exercise is very important. But just think about it. When you have a gradient, it's a pressure difference. And if you can calculate the gradient and you know any one of the pressures, you can calculate the other pressure. Okay, so that's basically what it is. I am going to stop here because I want you guys to fully grasp what we're doing. So again, the modified Bernoulli equation, you need to go over it, understand how you derive it. Okay, states that the pressure gradient is equal to 4v squared, where v is the velocity. Okay, so just go over the lecture and fully understand what we have done so far. So what I'm going to do is on Thursday we'll pick up from here, and we will continue. But hemodynamics is extremely important. Okay, all right. Once you understand hemodynamics, then you can calculate all sort of stuff. All right, so we will put the lecture on YouTube channel so you guys can go over it. Um, okay. Um, if I think it's best because we have people with different level of understanding. So if any of you guys have any questions, just text me and I will try and deal with it in a one-to-one situation because we have people who are beginners and they may be a little bit timid to ask any question right here. So you know, if you have any question, just text me and I'll try and uh, give you a clearer understanding. All right? All right, good night.